Hi everyone, this is BritSimon. I want to talk to you today about the new proclamation that was issued yesterday by President Trump regarding health insurance for new immigrants. It's an important topic. Let's get into that. So firstly, let me excuse my dog. It's a beautiful Saturday morning here in California, and my dog is obsessed with the ball, won't leave me alone. So as I'm sitting out here in my garden, I've got no choice but to play ball with her. So excuse me. Let's talk about this proclamation, what it means for immigrants currently going through the system. I think the first thing I should say, and I'm sorry, I'm going to be ducking out of camera here because of my dog, so forgive me. But the first thing I should say is we don't know very much about the proclamation as it stands at the moment. It was issued yesterday. President Trump, and he's got an advisor called Stephen Miller, have come up with a number of ways of limiting the entry of immigrants. It's generally speaking anti-immigrant, but also particularly anti-Muslim, frankly, and it is also, it seems, slanted against, generally speaking, poorer countries. So I think in President Trump and Stephen Miller's mind, it would be absolutely fine if the immigrants were from the UK, from France, from Germany, European countries, people that look like me, right? Wealthier people. That's absolutely fine in Trump's book. What's not fine is people from perhaps less well-developed countries, poorer people, people that are perhaps going to have a more difficult time when they arrive in the States. Now, I think on balance, it is correct to make sure that people have good plans, that they are not going to become a burden on the system, that they're not going to expect the system to just pick up everything for them, all the bills. That's fair and reasonable, and it's a justifiable concern of people living in the USA that we should not have the burden of those costs for new immigrants. On the other hand, you can't make policy based on racism and based on bigotry. And I'm afraid this is another example of one of those policies, frankly. I think it's convenient that you can also kind of justify this one in your own mind because of the cost on the healthcare system. I don't think it's because of the healthcare system. The basic premise is that immigrants in general are more likely to be uninsured for health insurance than residents in the USA. That is true. However, if you're concerned about people getting health insurance in the USA, then do something about it, President Trump. Do something about it, Republicans, because the Democrats certainly want to do something about it, right? So, there needs to be better healthcare system in this country. It's frankly shameful that a country such as this can't provide a basic human right to people, which is healthcare. We have advanced technology here. We have some of the best research here. Is it really too much to ask or too much to expect that for the money we already spend on healthcare that we can cover everybody? Just to give you an idea, the cost of healthcare in this country is $10,000 a year per man, woman and child, for every man, woman and child in the country, right? That's the actual cost that is being spent on healthcare in this country, but it doesn't cover everybody. Now, in the UK, where I come from, the spend on healthcare through the nationalised system and also private insurance, the combination of those two things, is around about $5,000 or $5,500. So for about half the price, we cover everybody in the UK. So for $10,000 a year, why can't we cover everybody in the States? I don't understand. I do understand, frankly, but that's another topic, and I will make another video about that at some later date. But more importantly, this topic is about the proclamation that was given yesterday. So essentially, Trump has announced that he's implementing a policy on November 3rd that will mean that people have to have certain types of insurance in order to be issued with an immigrant visa. So this doesn't affect people going through the DV registration process today, and it probably doesn't affect people that are well, it certainly doesn't affect people that have already been issued their visa or have their green card already, and it won't affect people that get their visa during the month of October. But if this policy is left unchallenged by some legal challenge, if it's left to go into place, from November 3rd onwards, an applicant would need to provide insurance, proof of insurance, for the period of time when they arrive in the States, for health insurance. That's actually very difficult to do. The rule is written in such a way that I actually don't even understand how they expect many of the insurance types to be issued, because you can't get an ACA plan prior to being here. You can't have an employer plan prior to being here because you won't have a job. So honestly, this one's unworkable, and seems obviously unworkable. I think perhaps that might be the point. So, you know. But anyway, a couple of the plan types that were suggested in the proclamation are temporary insurance types. There are policies like that, policies designed for people coming to the USA either for long periods of time as an immigrant, and designed to bridge the gap between the day of the first entry to the time when they get a more permanent solution for healthcare insurance. Those policies are not as good as an ACA plan, which is what everybody should have. An ACA plan is sometimes called Obamacare. Everybody should have one of those sort of policies, and you know, in a lot of jobs, that's provided as part of the benefit package for employment. But so these policies that are available are really a sort of a backup plan. But if you have no other insurance, it's definitely worth getting one of these types of insurance policies. They're relatively affordable. Costs can be, you know, sort of, you can spend less than a couple of $100s a month, you know, for a reasonable plan. It can be, you know, a little bit less than that actually. Some quite affordable plans. But the proclamation says you must prove that you've got a year of, or 364 days as a minimum of insurance, so basically a year of insurance. So if the plan cost, for example, $150 a month, and you paid for a year's worth of insurance, that's $1,800. That's an annual salary in some of the countries where people are coming from, right? So how's that going to work? It's unworkable, and frankly they know very well it's unworkable. So I have a relationship with an insurance company here in the States. They provide these sort of plans, and on my blog I provide a link, an affiliate link, to this company, so that people can find these types of temporary plans. They're a good option, I would say, as that bridge between the time you enter and, as I said, you know, the time you get a plan. So for 2 months, 3 months, fine, use one of those plans. But I hadn't considered people getting a full 1 year plan on that. Really, within a year, you are possible or likely to have some sort of health episode. You don't want to take a risk for a long period of time over here without health insurance. So I really saw that people should get onto the better type of plan. An ACA plan that gives you proactive coverage, health screenings, you know, all the sort of standard stuff that you would expect from within healthcare coverage. I think people should have those sort of plans. Yes, they're slightly more expensive, but frankly you need to build that into your budget, and wages earned over here generally should allow for that, right? And as I said, in some jobs you're given a plan which would normally cover yourself, and perhaps you might upgrade that to cover your family. You might have to pay some sort of additional cost. I do. I pay around about, I think I pay about maybe $800 or $900 a month for my healthcare plan. No, not that much. Not that much. Maybe I'll check, but I think, you know, I pay, you know, $700 or $800, let's say. but I know the plan itself costs $2,000 a month, so my employer is picking up the remainder part that I don't pay for, and that covers my family. So that covers myself, my spouse, and my wife and my daughter. If I had more children, it would cover those children too. So it's not bad. It's a very good health plan, but it's not cheap. And for someone coming to the States for the first time, they'll be frankly shocked at the cost of these plans. So yeah, in general, healthcare over here is expensive, no doubt. You should not be over here without insurance. That is absolutely true. You should not want to take that risk as a new immigrant. If you have a health episode, a simple, go out and break your leg. You can do it just walking down the street. You can trip and break a bone, right? The bill for that will cost $25,000, $50,000. If you're uninsured, how are you going to pay that? It's it's going to wipe out your savings in a heartbeat. So you can't afford to be uninsured in the USA. So I think on one side, I can see the intention is correct to protect the healthcare costs in this country, to reduce the number of uninsured people. Those things are positive things. But this, I believe, is not about healthcare costs in this country. I think it's another way of saying, actually, we don't want poor immigrants to come to the country. I fully expect this to be challenged in court. I would hope that somebody would achieve a TRO, which is a temporary restraining order, against this policy in one of the federal courts, and that would at least delay the implementation of the policy until it can be sorted out how people can be covered on this at reasonable cost, or whether waivers to this insurance will be given in general, because otherwise it literally seems unworkable to me as I sit here this morning. Now, there's only been 24 hours since the policy was put out there. I'm not an absolute expert in these matters. There are certainly experts that will be looking into this and trying to come up with ways of meeting the requirements of the proclamation, but for a reasonable or an affordable cost. And I will and have already started to reach out to the people I know that provide these sort of policies to say, what sort of plans could people come up with. And I'm thinking that perhaps someone could buy a one-year plan, but then with a cancellation policy. So maybe they have some sort of cost. Maybe they pay, an absolute minimum of a month, let's say, to give the insurance company some sort of coverage for the cost of the administration of the plan, but not have the full burden of 1 year's cost if they can't even use that policy later on. So anyway, I'll look into that. I'll see, what can be done with the people I know, at least, that provide these sort of plans. Great, excellent company that are very approachable, and I already have contacts there. So I'll look into that and I'll report back as I can find that out. But what I'll do now is I'll also take you through the proclamation itself and explain the main parts of that. We'll do that in a moment, and explain what I know of the proclamation and the policy at this point. But again, bear in mind, we're less than 24 hours after the proclamation. At this point, very little is known. It's totally new. It seems to have come out of nowhere. There's a complete lack of planning, which is just absolutely normal for this administration, so-called administration. So it would not surprise me at all if some court somewhere strikes this down, or at least delays it temporarily. So anyway, that's where we stand. Let's go through. I'll go through the proclamation now, and as I say, for people going through, so let's just broadly cover, for people going through the registration process right now, go through that. By the time DV 2021 is announced in May, it'll start processing in October of 2020, and won't complete processing, so some interviews won't complete until September 30th, 2021. By that time, I'm pretty sure one way or the other we're going to have a new president, a new administration. We may not, we may have more of Trump. if common sense prevails, things like this will get very quickly cut down. But otherwise, we could be facing this as yet another wrinkle. Okay, but I would not want you to stop entering the current lottery period simply because of this. For people going through DV 2020 right now, try not to panic. There's a month or so before this is implemented. During that time, I am expecting a temporary restraining order to be put in place against this policy, or at least some better explanation and some reasonable idea how the provisions in the proclamation can be met at an affordable cost, a reasonable cost for most people. Okay, so that's where we stand. And then, as I mentioned, people that already have their immigrant visas through DV 2019 or have already started to interview in early DV 2020 during the month of October, everybody that gets issued up until November 3rd by the terms of the proclamation will not be subject to the terms of this proclamation. It also won't impact other people. So nobody else freak out at the moment. Please just try and remain calm, and we'll figure out what's going on. So let's go to the computer, and I'll record some of the information and just show you the proclamation. Okay, thanks.
Okay, so this is the White House announcement of the proclamation. You can see it was issued on October 4th. I'm recording this on the morning of October 5th. So as I say, this is pretty new. So firstly, there's a preamble that talks about the justification behind the concept. And as I mentioned before, I actually don't disagree with much of this. I am concerned about the uncompensated healthcare costs that hospitals deal with. Trump and team are pointing out that this exceeds $35 billion in each of the last 10 years, and that averages out to $7 million of unpaid fees, unrecoverable fees for each hospital in the United States. Who pays for that? Well, I pay for that. Other taxpayers and other healthcare, insured people pay for that because it drives up our costs. If everybody shares a fair burden, then ultimately it will cost us all a little bit less. And so that is a side of it that is accurate, is correct. I don't have a problem with that fundamentally. However, as we go down the implementation, we can see more and more the real nature or the real thinking behind this concept. So firstly, it's a suspension and limitation on entry. So it isn't about the entry. Just while we're talking about entry, the entry point when you go into the United States as a new immigrant for the first time is more or less a formality. This would not be implemented at that point. As you'll see in a moment, it would be implemented during the interview process before the actual visa could be issued, right? So we'll come to that in a moment, but basically somebody would have to be they would have to be covered by an improved health insurance within 30 days of the alien's entry into the United States, right? There's a possible get out of jail, sort of possible workaround here. The 30 days is a possible workaround I'll talk about in a minute. But so somebody would need to have an approved health insurance under one of the following plans, right? So this talks about employer-sponsored plans. Well, you can't get that as a DV immigrant because you're not coming here for an employment type relationship. You'll only find work once you get here. An unsubsidized healthcare plan offered in the individual market within a state. That refers basically to Obamacare plans or ACA plans. The unsubsidized bit means that as a low-income individual, you can get a subsidized plan. But what they're saying is, we don't want to pay for your subsidy. So you need to have you need to be able to afford and prove that you're going to have an unsubsidized plan. Okay. So yeah, that's kind of sucky. Short-term, limited duration health policy effective for a minimum of 364 days. That's basically a year, right? So one day more than that is a year. Um, so it's 1 year policy, or if you are planning to enter and then leave, let's say 2 months later, let's say you had a return ticket 2 months later, so your trip here was just what we call an activation trip. You're going to enter, look around a bit, perhaps look for a place to live, etc., then go back home after some period of time, a week, 2 weeks, a month, whatever. You go back home and you cut off ties with your home country, preparing yourself more fully for the final entry into the USA. So we call that first trip an activation trip. You're activating your LPR, legal permanent resident status, so it seems to be that if you have a planned exit out of the USA, they would say, okay, you only need insurance for that period, that initial period of entry. So that's another possible sort of get out clause there. We'll see. This plan in point 3 is identical to point 7. I don't know why they've listed this twice. Just seems to be the Miller-Trump organization not knowing what they're doing really. But these are essentially the same thing. Point 7 is the same thing. The catastrophic plan is a type of insurance that, again, you're only going to have access to in the USA. A family members plan, well, that might be a possible if you were coming on a family-based plan. So let's say you're coming over, but you're a 24-year-old kid and you're coming over to live with your family, right? That are already here. You can be covered on one of the ACA plans up to the age of 26. So for some people, they will be able to extend coverage within their normal family plan. So that has a purpose, but not for DV lottery. Then we talk about medical care under Chapter 55 of Title 10, including the TRICARE program. This is to do with military service. So again, I don't think this is going to be applicable to most people. Then a visitor health insurance plan. We already talked about that in point 3. Medical plan under the Medicare program. Well, you're not going to be able to access that straight away, and you shouldn't, as that's one of the concerns for public charge. So, as an adult accessing that program, you shouldn't do that. It's okay for kids, by the way, but not for adults. Any other healthcare plan that provides adequate coverage as defined by the Secretary of Health and Human Services or his designee. So that is kind of okay. We'll consider other plans, right? And so if people like insurers can come up with a plan that somehow covers this situation uniquely, then that might be a possibility. That's one way they could design a policy that would be approved by the Secretary of Health and Human Services, right? And then for people over the age of 18, it does not include coverage under the Medicaid program. Okay. And so that's the type of plans that you should have, right? And then it talks about who it should apply to. And basically for DV lottery winners, it's you. It applies to DV lottery winners. It will also apply to a number of other types of immigrants here, but it will apply to DV lottery winners within yourself, and probably your spouse and your family as well will need to be shown to be covered. There is this point here about an alien under the age of 18 not being expected to provide insurance, but that would only apply to a DV lottery winner if you were 17 years old, you were entering by yourself, not entering with a family, because if you're an alien accompanying a parent who is also emigrating to the United States, and subject to this proclamation, well, that messes that up. So it's only for very young entrants that might get around that. They've met the education requirement, but haven't yet reached the age of 18. Okay, so that's a very small number of people. So there you go. That's who's in there. Implementation and enforcement. This section here talks about how this will be implemented and when, rather. So an alien subject to this proclamation must establish that he or she meets its requirements to the satisfaction of a CO before the adjudication and issuance of an immigrant visa. In other words, before the CO can approve your case, they have to believe that you have an adequate plan in place, or you perhaps have some sort of specific plan on how you're going to take that insurance plan. It may be that the implementation of this comes down to you undertake in some way to get this sort of insurance within 30 days of entering the USA. Perhaps this will come down to a document that you sign agreeing to do that, in a similar way that people agree to sign up for selective service. If they're under 26 and male, you have to sign up for a selective service in the military, and when you come into the USA, every male under 26 has to do that, whether they're immigrants or not. So it may be that this comes down to something as simple as that, which wouldn't be too bad. It would be an undertaking, a promise to do so. But if you then go back on that promise, so it says here, an alien who circumvents the application of this proclamation through fraud, willful misrepresentation, or illegal entry, blah blah blah. What they're referring to there is, I think they're opening the door that says, okay, if we get down to a promise here to pass the CO interview, and you are planning not to take that insurance, then you have willfully misrepresented, and then you will be a priority for removal by the Department of Homeland Security. In other words, they'll deport you. Or they could deport you, right? So you can see how the law it would be, or how the construct of this implementation would work. You maybe are going to make a promise, but if you break the promise, you'll be deported. That's the threat, right? So that's how that would work. And then there's a little bit more information in the rest of the proclamation. By all means, go and read this. I'll put this link in the description below, but you can see, how that's working here. And then finally, in section 7, the effective date. The proclamation is effective on November 3rd, 2019. Okay, so they're giving it a 30-day window of time to implement this. Like I said before, and I'm pretty sure there will be legal challenges to this, and it's possible or likely that there could be a restraining order against this in time to stop this implementation by November 3rd. So I'm quite sure there's lawyers all over the country gearing up for this argument right now, even though this is only a 24-hour-old argument. The president has certain powers. He has, and he's referred to the powers that he's calling on within this proclamation. He does have those powers, but he can't. You can't justify everything under these sort of blanket justifications that they have, which is listed at the top of this. The blanket justification is this. 212F and 215A. This is basically protecting protecting the interests of the United States. It's a very broad definition, and so now that can be tested in court to say whether this particular decision and proclamation is truly necessary to protect the United States, which is one of the main responsibilities of the US president. So okay, there you have it. You've heard my thoughts, my undiluted thoughts in the beginning part of my video. You've seen the proclamation here. Like I said, this is only 24 hours old. I don't want to stir up a lot of unnecessary worry about this. But I do think it's worth actually just having some decent information out there, a little bit of a calming voice on all of this. People are going to read things, they're going to be panicking. I'm already getting emails from people that are panicking about this, and so I just wanted to sort of, paint the picture in a realistic but not panicking way. Okay, so that's hopefully what you've taken from this video. I hope that's the effect. Otherwise, I'm going to be very busy answering a bunch of questions. So there you go. Good luck in everything you're doing at the moment. Let's hope that this particular problem goes away soon, and that we have improvements to the system without necessarily making life so difficult for people that all they want to do is live a happy, safe life in the United States. That should be a reasonable goal and something that we in America should be able to support without concern. So, okay, have a great day. I hope this was interesting. If it was, please do let me know by liking the video or submit a comment below in the comment section below. Please do subscribe to my channel for more information about the DV lottery process or immigration in general in certain matters. This one covers more than DV lottery, clearly. So let me know and subscribe and continue getting this sort of information. Okay, have a great day, everyone. Bye bye.